Welcome to Boston Community Health. I'm Dr. Elias Bourne. In geriatric medicine, we define type 2 diabetes as a silent stalker because it never presents with immediate, agonizing pain, but instead hides behind subtle physical shifts you often mistake for normal aging. Today, we will expose the 5 hidden signals this master disease utilizes to systematically destroy your vascular foundation while you remain unaware. The primary metabolic error for individuals past age 40 involves ignoring persistent fatigue or abnormal thirst, allowing chronic insulin resistance to silently transform their entire bloodstream into a thick, toxic, and highly inflammatory fluid. When glucose concentrations remain chronically elevated, it is far more than a mere laboratory metric. Biologically, these excess sugar molecules function exactly like billions of microscopic glass shards, continuously striking and eroding the smooth endothelial lining inside your arterial framework. This widespread destruction triggers a cascade of chronic systemic inflammation, rendering your vessel walls rough, inelastic, and providing the ultimate landing zone for cholesterol plaques to aggregate. This represents the absolute root of all catastrophic events, ranging from cerebral strokes to widespread heart failure commonly faced by the elderly population. Why does the body initiate these subtle distress signals? The answer resides within cellular insulin resistance. Insulin operates as the essential medical key opening cellular doors to allow glucose influx for energy conversion. When these cellular locks become distorted due to a sedentary lifestyle and excessive refined carbohydrate intake, sugar remains trapped inside the bloodstream, while your internal cells are literally screaming for energy. This state of starvation amidst a sea of sugar causes your brain to panic, continuously launching biological regulatory signals that generate the everyday symptoms we are about to expose. Silent sign number 1 is unquenchable thirst, accompanied by frequent nocturnal urination. Please click like, subscribe to Boston Community Health, and comment right now. When blood glucose levels skyrocket, your kidneys are forced into a state of hyperfiltration to excrete sugar via urine. This osmotic process draws massive water volumes out of your cellular tissues, driving severe cellular dehydration. The more you consume, the more the kidneys flush, and consequently, your deep sleep architecture is fragmented. Stress, cortisol spikes adorn, further ravaging your cerebrovascular framework. Silent sign number high delivers the sudden, intense, afternoon craving for sugar or heavy carbohydrates. This represents the desperate scream of brain neurons currently starving for metabolic energy due to insulin resistance. As you consume sweets to satisfy that craving, your blood glucose spikes even higher, constructing a vicious inflammatory loop that renders your arterial walls increasingly rigid and more fragile than ever before. Silent sign number 3, which individuals past age 40 often mistake for normal presbyopia, involves sudden blurred vision or fluctuating visual clarity. Chronic hypoglycemia alters the osmotic pressure inside your eyeball, causing the lens to swell as it accumulates glucose-rich fluids. This shifts your eye's ability to focus light accurately, making everything appear hazy. If you fail to intervene and return your hemoglobin A1C to safe zones, the microscopic capillaries in the retina will rupture, driving retinal hemorrhaging and irreversible blindness, ruthlessly stripping away your physical independence across lifespan. Silent sign number 4 presents as peripheral numbness, a pins and needles sensation, or a burning feeling inside your fingertips and toes. Clinicians designate this as diabetic peripheral neuropathy. Persistent high sugar aggressively assaults and destroys the myelin sheath protecting your nerve fibers, while simultaneously occluding the tiny capillaries nourishing your peripheral nerves. Once the nervous system is compromised, the brain no longer receives accurate feedback from your lower extremities, causing seniors to suffer falls or develop silent necrotic wounds without even realizing it until it is too late for clinical salvation. The final silent sign involves minor scratches, insect bites, or bruises taking an abnormally long time to resolve. A healthy body activates immediate tissue repair, but in those with high blood sugar, the thick, sluggish blood prevents white blood cells and vital nutrients from reaching the injured zone. Furthermore, bacteria aggressively thrive in a sugar-rich environment, allowing wounds to easily develop deep, spreading infections. If you notice a tiny cut remaining red and inflamed for over a week, it serves as a critical warning that this master disease is ruthlessly manipulating your entire circulatory framework. To confirm suspicions raised by these 5 signs, The most scientific management option involves undergoing a hemoglobin A1C laboratory test. Unlike rapid finger prick glucose monitors that only reflect a snapshot in time, the A1C metric represents the 3-month average of glucose permanently attached to your red blood cells. This serves as the most honest roadmap exposing the entire chronological destruction of your vasculature. If this number exceeds the 5.7% threshold, you have officially entered the pre-diabetic stage, the golden window to reverse your medical destiny. Why must we fear these subtle signs? Because chronic hyperglycemia is the primary driver constructing unstable, fragile atherosclerotic plaques inside your carotid arteries. Under the mechanical shear stress of morning circulation, these plaques can easily detach, launching into cerebral blood flow to occlude major vessels. This is the clinical script for devastating territorial strokes, stripping away life or leaving permanent disability. Early recognition of these silent symptoms represents the ultimate intervention to save your cerebral vasculature before it becomes too late for effective medical rescue. Your first actionable management option at home involves implementing the sequenced 5-first dining protocol to lock your blood sugar stable. Always initiate your meals with a plate of fiber-rich green vegetables before transitioning to proteins and carbohydrates. As fiber arrives first, it dissolves into a dense biological gel mesh coating your intestines, severely delaying glucose absorption into your bloodstream. This simple lifestyle intervention successfully halts post-meal sugar spikes, lifting the heavy workload straining your pancreas while maintaining your vessel walls perfectly smooth and free from dangerous plaque aggregation. Actionable management option number 2 focuses on the continuous stationary calf raise routine 15 minutes immediately after meals. This routine activates your lower leg soleus muscle, the singular muscle mass capable of drawing glucose directly from circulation to burn for fuel completely independently, requiring zero assistance from insulin currently resisted by your cells. Executing this rhythmic movement for 15 minutes daily successfully clears excess sugar waves, shielding your cerebral and cardiovascular frameworks, while preventing devastating peripheral nerve necrosis in seniors past the age 60 milestone. Finally, if you recognize any of these 5 silent signs, strictly demand a duplex carotid ultrasound and a brain MRI scan from your healthcare provider. Standard clinical examinations remain completely blind to localized threats expanding deep inside your skull framework. Visually analyzing plaque architecture and silent lacunar infarct scars represents the wisest medical intervention to master your own health destiny. Never allow this master disease to silently strip away your mental clarity and physical freedom. Implement these actionable steps the absolute moment your body signals distress. I want to leave you with a profound clinical philosophy of geriatric medicine, the devastating complication you successfully prevent through your intelligence and consistent daily movement will never make dramatic breaking news. The stroke or heart failure pushed back from afar carries no intense resuscitation moments inside an emergency operating room. It remains completely quiet. The beautiful outcome of that wise prevention is just an ordinary morning where your brain stays sharp, your steps remain steady, and you continue enjoying warm conversations with family. You do not need to live under passive anxiety or surrender your biological destiny to an unfeeling automated medical framework. Please click like, subscribe to Boston Community Health, and comment your glucose numbers below. Recognizing these 5 silent signs and implementing these natural home methods keeps your vascular networks fluid and rhythmic. Once your peripheral circulation is cleared from thick glucose-saturated blood, the heavy operational workloads straining your heart and kidneys are instantly lifted. This represents the wisest clinical roadmap, helping older adults maintain vital life energy, comprehensively shielding your central nervous system, and successfully sustaining peak physical clarity regardless of the passage of chronological time across lifespan. We will consistently remain here to deliver the most authentic, scientific, and evidence-based knowledge throughout your health autonomy journey. Our professional mission is to deliver honest, international geriatric knowledge without fear-mongering to help you dominate your health destiny. Your brain and cardiovascular system remain completely priceless assets, deserving your highest level of wise protection daily through simple daily habits. Shielding your blood vessels during the pre-diabetic stage through sequenced nutrition and target movement represents the primary clinical intervention to effectively shatter the destructive cascading loop driven by chronic diabetes. We understand that confronting the silent signs of type 2 diabetes can generate significant confusion and anxiety for patients. Widespread individuals across the United States and globally have succumbed to devastating complications simply due to a severe deficit in authentic clinical knowledge. Therefore, this medical video series is meticulously designed to serve as your operational roadmap, empowering you to confidently communicate with your physician and assume absolute autonomy over your well-being. Always stay sharp, stay highly informed via accurate medical data, and maintain persistence to protect your healthy longevity path. Within next week's educational series, we will deliver advanced clinical investigations targeting strategies to reverse chronic fatty liver disease, a dangerous pathology frequently traveling alongside and amplifying middle-aged insulin resistance. This represents a highly critical subject, helping you construct your complete metabolic defense network, maintaining your peak physical clarity regardless of the passage of chronological time across your lifespan. Remember clearly that naturally clearing your vascular lumen begins directly from your dining table and your moderate microvascular exercise routines, lifting the immense workload straining your pancreas without costs. Bring all of today's vital medical insights together. We have thoroughly exposed the true biological nature of these 5 silent signs this master disease utilizes to systematically erode your vascular endothelium, coordinating the sequenced fiber-first dining protocol and soleus muscle calf raises represents your ultimate natural weapon to clear glucose, successfully shielding your cerebral and coronary blood vessels. To successfully transform today's complex scientific knowledge into a practical protective weapon for your next physical checkup inside specialized hospital facilities, I want to provide a concise clinical communication protocol consisting of 3 strategic queries to discuss directly with your healthcare provider. When you confidently present these highly informed academic queries, you force the physician to concentrate on constructing a personalized prevention framework tailored precisely for your physical status, completely eliminating vague guesswork. Allowing you to actively master your strategic query number 1 you strictly need to present to your physician is based on my middle-aged physical status and current insulin resistance signs. What are the exact target blood pressure metrics and optimal hemoglobin A1C thresholds I must maintain during home logging? This crucial query forces the clinical conversation toward establishing a clear biological milestone, allowing you to accurately evaluate the real-world efficiency of your daily microvascular movements and dietary changes, effectively shattering catastrophic organ collapse risks from afar. Strategic query number 2 you strictly must discuss during your clinic appointment is: given my structural vascular risks driven by chronic hyperglycemia, am I an appropriate candidate to undergo a duplex carotid ultrasound and a brain MRI scan to evaluate for silent Lacunard infarcts? This question advances your medical dialogue into specialized neuroimaging dimensions, completely exposing and detailing underlying arterial threats expanding inside your skull before devastating physical complications erupt and ruthlessly destroy your vital lifespan. Strategic query number 3 you strictly need to ask to finalize your protective shield is: do I require an overnight 24-hour Holter monitor evaluation right at home to completely rule out paroxysmal atrial fibrillation risks? Presenting this complete trio of strategic queries demonstrates that you represent a highly informed individual possessing profound wisdom during your personal journey to safeguard your physical freedom and cognitive clarity across lifespan, refusing to surrender your body. Share this educational video link with the people you care about most: a spouse living alongside you, an aging parent, or a sibling over middle age who needs this vital screening data. The individuals who are at the highest statistical risk of facing this sugar-induced vascular storm will likely never search for these clinical studies online. Your small act of digital sharing today might become the exact reason someone's vascular system and cerebral cortex are saved from a devastating future event, perfectly preserving their physical freedom. Write down these 5 natural methods and 3 strategic questions on a physical sheet or store them inside your phone app to serve as your permanent roadmap. Many individuals dangerously delay lifestyle modifications, waiting until severe vascular complications erupt before panicking and seeking heavy chemical prescriptions. This represents vascular suicide. The true clinical power to shield your vascular lumen resides entirely inside your consistent daily discipline over small habits within your comfortable living room space. Implement the sequenced fiber-first dining protocol and execute your moderate soleus muscle calf raise routines starting today to successfully preserve the non-stick integrity of your cerebral vasculature across lifespan. Please click like and subscribe to Boston Community Health right now and leave a comment below about the silent sign that concerns you most. Wishing you continuous health and see you next time.